there are a lot of things about this country that has not set us up well before we ever anticipated of having this kind of population aging. That has not set us up well for success in that regard, and that's true at kind of the national policy level. At the individual level, like I already mentioned earlier, we're just not good at planning ahead. People don't want to talk about their own mortality. As counterintuitive as it may sound, I actually think that the more we brace our own mortality, the higher our quantity and quality of life will be. But we just don't want to talk about that. We don't want to get life insurance. We don't want to go ahead and put some money aside to plan for our funeral and whatnot, so our children don't have to worry about that. We need to get better at having those conversations. I think that we are, but we'll have to see how your and my generation does better when we are in older age, right? Maybe things are getting better, but those are some things that we just don't do well. And aging is extremely gendered as well. It's very, very gendered. That's a whole other conversation. But anyway, we got to get better.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Jacob Kendall. Dr. Jacob Kendall is founder, speaker, and consultant at The Smart Patient. He's also founder, coach, and speaker at The Versatile Social Worker. Jacob helps demystify health and healthcare to empower patients in their healthcare decisions. He helps patients and providers build optimal partnerships for optimal care and works to demystify healthcare for patients, providers, and caretakers. He conferred a Bachelor's of Arts in Biology at Huntingdon College, then a double Master's of Social Work in International Social Work and Master of Public Health in International Health and Development at Tulane University. He then received a PhD in Interdisciplinary Aging Studies at Tulane University School of Medicine and is currently getting a Master of Divinity in Theology at Mercer University, McAfee School of Theology. In today's episode, you'll hear and learn more about how having 2 open heart surgeries and complex health needs shaped his perspectives on health and healthcare, the importance of empowering patients in their healthcare to have better outcomes, why planning for aging and mortality is often neglected in society, how he brings his 4-dimensional thinking to understand and address health and public health, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hi, this is Jacob Kendall. I am a gerontologist, speaker, and public health professional, and you are listening to Public Health Careers.
Welcome, Jacob. So excited to dive into your story and more about your experiences. But thank you so much for making time to chat today.
Yeah, thanks for the opportunity. I've been looking forward to the conversation.
Awesome. So to jump into things, how do you identify and tell us a little about your personal background?
Yeah, for sure. Well, I said that I'm a gerontologist. I really like to say meta-gerontologist, but not a lot of people don't know what that term means. So gerontologist means you study aging, and meta means that it's basically I look at aging from many different perspectives. I prefer to be a jack of all trades rather than an expert of one, and approach public health, population aging, and healthcare issues from many different perspectives, not just medical, not just individual, etc. And then on the personal side, I've had 2 open heart surgeries. I have lifelong complex medical needs. I've had hundreds of encounters with physicians and nurses, and just a lot of healthcare basically. And we have a very inefficient system. And so a lot of what I do right now is speaking and consulting to help patients and caregivers gain more power back in their healthcare, because our healthcare system makes it seem like we don't have a lot of power. So I combine my professional expertise in public health, social work, aging, with my personal experiences, and that's what I do now. When it came to healthcare, push came to shove, so I'm shoving back.
Love it. And we're going to start there. So you're a survivor of 2 open heart surgeries. What was that experience like?
Yeah. Congenital aortic stenosis runs on my mom's side of the family, and I was one of the lucky ones to get it. Usually, aortic stenosis is something that occurs later in life. It's not usually a genetic thing, but with us it is. And mine was either mild or moderate up until my late 20s. I was in the middle of my PhD program, and then I learned that I needed to have it replaced the first time. And so I had it replaced then with a specialized procedure, and unfortunately it did not last as long. as I wanted it to. So nearly 6 years later, I had it replaced again. This time I have a mechanical valve. So hopefully it'll last a bit longer. And you never just have heart surgery, right? There's always more stuff to happen around that. I'm on blood thinners because I have to be. I'm on anti-anxiety medications for static brain bleeds. I have chronic debilitating pain in my back. Dental care is really important because I got to protect my valve from getting bacterial infections. So, it's never just heart surgery. It's none of this happens in a vacuum. So yeah.
Well, I appreciate you sharing that. And was that your entrance like into this complex health condition? Like how did you relate with the healthcare system, maybe growing up and then coming into having these heart surgeries and then moving forward?
Yeah, it was never as much of a big deal until I had my first surgery. One of the things that happened before then that sticks out the most is, and I don't remember when this was, maybe several years before my surgery. At that point, I just had the condition congenital aortic stenosis, but it was mild at that point. And even then, this is before Obamacare, and so we didn't have these protections for people with pre-existing conditions. And then before I even had my surgery, I did have a major health insurance company deny me coverage because of that. And my mom, who has the same issue, was like, no. She called them up like, listen, I got a policy with you folks. I have the same issue. You need to give them a policy. And they did. And then, of course, one of my favorite things about the ACA, about Obamacare, is that there was that stipulation in there specifically designed to protect people with pre-existing conditions. And now there are a lot of people who are wanting to remove that. And I'm really, really concerned about that. And so that's definitely part of it on the policy side. Just on the personal experience side, I got so tired of the fact that, I'm 38 now. And the older you get, more specialists you got to see if you have chronic illness. Like I said, it's never just one thing. And it just became clear to me over time that, like, man, this is just far more inefficient than it needs to be. It doesn't have to be this way. And a lot of it's deliberate because insurance companies and the medical industrial complex they make a lot of money when Americans are sick. So, that's hopefully that connects the dots from my previous experiences to what I'm doing. I mean, I'm just pissed about the system. It's so ridiculous.
Yeah, and I think like to that point you're saying and firstly thank you for sharing and being vulnerable, and also awesome to see that despite these things you are continuing on and wanting to affect the system that you have seen impact you yourself personally, and empower patients in a very broken healthcare system, if we're being honest here. So I definitely appreciate that. And then maybe shifting back to more of your passions and stuff, you share that you are a jack of all trades. Tell us how being a four-dimensional polythinker impacts healthcare.
Yeah. Well, I think that four-dimensional thinking is something that I'm currently working with it. I apply it to health because that's what I focus on, but I think you can fill in the blank with whatever social problem. So I'll talk about it in terms of health. The phrase the one sentence that I typically use to explain what I mean by that is that health, and by extension healthcare, is more than individualistic medical here and now. It's the three dimensions of space, one dimension of time. We're a very individualistic society here in the U.S. American individualism, capital A, capital I, is like it's so deeply cultural that it's embedded in our bone marrow. Like that's just how we tend to think. And I think that we can take it too far. I think we have taken too far. And so we get into this notion of everything that happens with my health is on the individual level. And even wanting healthcare reform, I can't tell you the number of times I've had conversations with people and they're like, well, I don't want any form of socialized medicine or whatever because I don't want to lose the ability to choose my own provider. Whenever someone says that to me, I think two things. First of all, there's no way you have complex medical needs and you're saying that right now. Two, you actually don't have as much freedom to choose your provider as you think that you do. So it's more than individualistic. This is where public health comes in, right? We can look at the pandemic. The pandemic was more than people making individual level decisions. It is a public health issue. We have to analyze health at these different levels. It's more than medical. Look, I have some really great providers, but doctors don't know everything. We shouldn't treat them like we shouldn't expect them to. What physicians say is not biblical truth. There's the social component. There's a financial component. There are spiritual components to health. There are all these different aspects of health. And if you only focus on the medical, you're not going to get where you want to get, right? Health is more than here. Um, I live in one of the fastest growing counties in the state of Alabama, and one of the fastest growing in the country. And there are tons and tons of people still moving here. And I'm concerned about affecting healthcare access in the future because we just don't have the infrastructure to handle it. So my wife and I are having conversations, especially after recent elections, like, hey, where can we move? We don't have to have this concern moving forward. So we got to make those comparisons. And healthcare is more than now, right? We are so terrible at planning in advance. Being a gerontologist and focus on aging, it is a huge problem right now. The older adults did not prepare with life insurance and planning for their deaths. And we don't want to talk about our own mortality, but we need to be having those conversations earlier, right? It's not just about right now. It's let's think out ahead of time and make sure that you and your loved ones are provided for. What can you do to when you inevitably have some kind of issue come up medically? You don't want to be in the dark about that. So health is more than individual medical here and now. That's what I mean by that. And it takes multiple disciplines working together to come to that conclusion. And I want specialists. We need experts. I'm really glad that the two surgeons who did my surgeries are really damn good at that particular kind of surgery. Awesome. I want that. But we need more interdisciplinary folks sitting at the table as well. So hopefully, I'm getting better and better at explaining that concept in a short amount of time. So hopefully that makes sense.
It absolutely does, and I think like I would like to dig a little bit deeper there because I feel like a lot of us say we want maybe that interdisciplinary perspective sometimes, but you actually, as we were learning your journey, you went out and got those different perspectives and those leanings. So maybe tell us more about that impetus. Like how did you come to that point? Like, okay, I'm going to do this and really build out my knowledge bases and all these different perspectives.
Yeah. Well, first of all, it's a childhood dream of mine to be a true Renaissance person. I like having different kinds of skills. That's just kind of my natural mindset. You are right that I think when a lot of people hear interdisciplinary, or I've been trying to find a term that means the same thing that travels outside of academia, multidimensional, something like that. People tend to think about fields or disciplines that are adjacent to one another, right? A geneticist working with a molecular biologist, something like that. And that's great. But we need to think more broadly than that. So my PhD is actually in interdisciplinary aging studies. That's a lot of syllables, so I typically just say gerontology, but that's what it is. And they said that the most important skill that we would have coming out of that program, unlike a discipline, if you go get a PhD in physics, and you're going to have deep expertise in physics, but we're broad. They said the most important skill you're going to have is being able to facilitate dialogue across many different disciplines that look at aging. And so we had seminars, we took courses in, we had discussions on, did projects in genetics and neuroscience and history and law and ethics and anthropology and demography and epidemiology. We looked at aging from those different perspectives. And like I said, that's just how naturally I think. And I also have my undergraduate degrees in biology, which I consider my true and original love. I have a Master of Social Work, Master of Public Health. Right now, I'm nearly done with the Master of Divinity and Seminary program. I wanted to add the humanities to all of that. You can call me stupid for pursuing so much education, but whatever.
I'm definitely not calling you stupid. I think it definitely speaks to that Renaissance man that you are that you saw in yourself in getting all of that. And I'm looking forward to unpacking that journey with the listeners today. But before we get more into that collegiate journey, what does public health mean to you?
Yeah, the way that I typically talk about, I see it as zooming in and out. Right. And if you think about health from a clinical perspective, it's nurses and physicians in the medical system largely focusing on what's going on with the individual and maybe working with families a little bit. Right. And that's down here on what I refer to as the micro level. In social work, we call it micro, meso, and macro. And public health is very macro, but I think public health covers a lot more of that. And we realize that we can't possibly understand everything about our health unless we zoom out and analyze it at different levels. One of my favorite examples to use is I don't want to support any kind of policy because that helps people who are obese because they just chose to eat too much. I've heard things like that before, but of course, public health professionals know better than that. Obesity is much higher. Much higher rates are in places that are lower socioeconomic status. They live in what we can refer to as food deserts, where the closest food they have, the greatest access to food they have is convenience stores, which are high in sodium, high in sugars, high in carbs, not good, not healthy diets, but there's no individual level decision that they can make that's going to give them access to healthier foods. That is not an individual level factor, but we can't possibly understand any of that if we don't zoom out to different levels, right? We need to be, what's going on, what policies in your city or your county or your state or nationwide affect what's going on with you? How does that trickle down to you? I gave an example earlier of of Obamacare, right? That literally, that one aspect of the ACA with protections for people with pre-existing conditions, it is not hard for me to trace the trickle down, the domino effect from a national policy to how that affects me as an individual. But if we just stay here on the level of the individual, we're only going to see so much. We got to be willing to view things through these different lenses. And I think public health equips us with several of those lenses.
So you began your collegiate career as a Bachelor of Arts in Biology student at the Huntingdon College.
Yeah.
Tell us about that thought process.
I loved biology since at least high school. Now, it was way before that. I always loved animals and weather and the environment, going out and viewing wildlife and all these things. And I absolutely decimated my biology courses in high school. It's just very clear this is a natural fit for me. So I knew I wanted to go into biology in undergrad. I loved it. And I definitely considered for a while making that my focus in grad school. There was something that kind of hit me like, I'm going to focus on the social sciences instead. And I just I guess I have to trust that instinct because there are many days I'm like, man, I'd really love to have a PhD in botany or something like that. But I'm using what I have. I like to think I'm using it for good. But what I've learned in biology is very informative. A lot of theories that we have in epidemiology and sociology come from ecology, right? We developed a lot of those models from ecological frameworks. And I think Darwin's theory of evolution is one of the most important, impactful theories of all scientific theories. Up there with thermodynamics and cell law and things like that. And I think that one of the most important books that I've ever read personally is Edward O. Wilson's Consilience, and it talks about how all knowledge is a spectrum. And I've been talking so far about zooming out with public health beyond the level of the individual, but I think that we should also zoom in, right? There's a growing emphasis, a growing recognition of cellular medicine, and even beyond that, quantum medicine. And I'm excited to see those things. So to me, biology kind of grounds me in realizing that as much as I have the expertise in zooming out, we also have these other perspectives. I do think that there is this continuum of knowledge that exists from genetics all the way up to epidemiology, and we haven't filled in all those gaps, but I'm very confident that they're there. And it gives me some of the natural sciences as well, because I went all social sciences after that.
And while you were in undergrad, you also had experiences as a youth minister assistant at First United Methodist Church, Summer Stafford Youth Works, and director of youth ministry. Tell us about those maybe key responsibilities or why you decided to take on these roles.
Well, I mentioned a bit ago that I'm currently pursuing a Master of Divinity, and then you just mentioned those jobs that I had while I was in college, and one might conclude that I have a certain religious identity, and I think one could reasonably conclude that. Most of my reason for pursuing a seminary degree now is personal interest, even as my own ideologies have shifted over the years. I have no desire to do ministry at all. I was raised in a very progressive, moderately progressive denomination, the Cooperative Baptist. And I went to a Methodist school, and those were just really important experiences for me. And I'm glad that I had them. I can say that I've done that. I don't care to be a professional minister now. It's just, we go through a lot of phases, right? I've been a professor of college students, and I had some students every semester, they wanted to do something different. I was that person too. So I get it. I also think that one of the things that I love about being having a broad background is that I think it allows me to relate to a wider array of people, right? And while it is true that me going to seminary is a personal thing for me, it's professionally, as a gerontologist, most people die in older age. And so there's that crossover with focusing on end of life issues. And that's where spiritual questions come up. I basically just want to be able to have a conversation with people that's emotionally mature, intellectually mature. And if they're a religious person, then maybe I'll have enough tools in my tool belt to be able to relate to them, right? And so I can draw from those experiences that I had in college. I can draw from what I'm learning now in seminary, and that's just kind of one of my goals. I want to be able to relate to a wide array of people. Hopefully that makes sense.
Yeah, absolutely makes sense, and I'm glad. I guess it got you to maybe reflect on that part of your journey and that evolution of whatever your beliefs are.
I'm on a lot of podcasts, and no one's ever asked me about that aspect of my work. So thanks for doing that.
Yeah, my pleasure. And it's interesting. Me and my brother just went and saw. I don't know if you've seen it, Heretic. It's a movie that's out in cinema now. I feel like you might appreciate the kind of context of that movie, and like
I'll keep that in mind.
Yeah, just like questioning maybe those religions and belief systems. So maybe you could watch it and let me know what you think.
All right, sounds good.
Awesome. So were there any undergrad takeaways that you had coming out with your bachelor's in biology?
There's a whole lot of pressure these days for people, for undergrads, to think that what they choose as a major matters. And it can, if you want to go into med school, then you have to take so many science classes, but that doesn't determine what major you need to do. If you want to go into nursing, you got to take certain classes. But even now, they have these fast track masters of nursing programs, master of social work programs and whatnot, where you can major in anything. I would just encourage people to realize that their interests are going to change. And even if you have multiple interests, but you choose one major, you're not abandoning these other interests. And I think the other thing that you feel pressured for is having a really, really good GPA. I'm not saying that it's not important, but listen, I had below a 3.5. I was on academic probation for one semester because I got terrible grades. And I now have 2 masters and a PhD. Like, listen, it's going to be okay. It's going to be okay. And also just take whatever experiences come your way. I also traveled around the world, and that kind of started when I was in high school, and then really ramped up when I was in college. And when you have an opportunity, even if you think it's outside what you expect your professional interest to be, go take it. Go take that adventure. Go do it. And I don't regret any of the interesting or adventurous things that I've done, any of the countries, any of the travels that I've done. Some of them are really expensive and put me in debt, but I don't regret any of them because they're experiences.
I feel that. Just don't go too deep in debt for those kind of experiences. But yeah, we only have one life to live, and there's so much value in traveling and doing these things that bring us joy and filling our cups. So I appreciate you sharing that as well.
Yeah.
So maybe walk us through the process of you graduating, maybe working, and then shift, because you said that you were in this bachelor's in this biology perspective. I wanted this biology work, and then you kind of shifted more to a more macro meta social sciences perspective when you decided to pursue a master's of social work. So walk us through more of that change and, okay, I want to do this instead of that.
Well, first of all, in undergrad, I was all macrobiology. I took ecology, animal behavior, field botany, field zoology. I loved the macrobiological courses. So even from an early time, I recognized that I liked the larger lens there. I knew coming out of it that I wanted to do either 2 masters or something very, very interdisciplinary. At that point, it was really clear that was the case. And my dad had a social work degree, and so there was that. And social work is one of those fields. Public health is another one where you can they have a lot of dual degree or combined degree programs. Social work and law, public health and theology, social work and business, public health and medicine. Like there's so many combinations. I'm like, okay, social work is clearly one of the ones I'm going to do. It makes a lot of sense. I'm used to my father had that degree. And then I was in Uganda. I had this moment. I was on a team of, it was a service learning trip, 13 of us college students. And we went to several countries, but we went to Ethiopia and Uganda back to back. And we visited clinics. We visited really rural areas. And we saw some of the poorest places in the world and some really awesome projects going on. And I'm like, this is public health, and this is what I want to do. And so that's when public health hit me. And so there are a lot of programs that offer social work, public health dual degrees, and I applied to a few of them, and I went to one of them. And that's kind of how that came to be.
That's awesome. And I think like just going back to what you're kind of saying is like putting yourself out there and getting those experiences kind of help to shape what that next step might be for you. So yeah. So going into that dual degree program, what were some of the, or like coming out of that dual degree program, what were some of the takeaways that you had?
Yeah, I thought that, which is what most of my peers did. I specifically focused on in my social work program. I did international social work, and then my MPH was from the Department of International Health and Development. So I knew that I wanted to focus on the developing world. And most of my peers who came out of those programs went immediately into the field. They went to do their practice and whatnot. And I expected to go work abroad for a couple of years, like many of my peers and friends were doing. But while I was in the master's program, I knew that I wanted to get my PhD, but I thought that I would wait. While I was in the master's program, Tulane, where I got my master's degrees, started this PhD program in interdisciplinary aging studies. And I wasn't interested in aging at that point, but the interdisciplinary piece is what caught my eye. And I'm like, I like that. So I just decided I'm going to go ahead and apply to programs. I was in my internship in India for my master's program when I decided I'm going to go ahead and apply for PhD programs. I retook my GRE to see if I could get a better score, and I did that in India. It all came together pretty quickly. So, that was kind of the track there. And I've never gone and done long-term work abroad, but I've done a lot of short-term things. But I think I took the right path. I would not encourage anyone to go to graduate school for 7 straight years, though. Please don't do that.
That is definitely good advice. And maybe from those experiences, those short-term experiences that you've had in various nations around the world, what are some takeaways or some lessons learned that you had from those experiences?
You're not going to do everything. Sometimes you might get sick. I contracted scarlet fever when I was in Nicaragua once, and I had to come home while the rest of my team kept on traveling. I caught a really bad stomach bug in Uganda, and the rest of my team went to do whitewater rafting on the White Nile, and I couldn't go do it. You can't do everything. You just have to take what comes at you and experience. You could plan a trip perfectly, but it's not going to go that way. So, I would encourage anyone who's feeling a little bit adventurous, go somewhere, land, and don't have all your plans worked out. And I've gone places and not had any plans worked out. Did that in Thailand, first part of my stay in India, and it's like, just have that kind of experience, right? Go off the beaten path a little bit. I'm not suggesting anyone do anything dangerous. I've never put myself in danger in any of the places that I've been. But allow some of it to come to you, and again, do it while you can. I'm married and I'm about to have my second child any day now. And that's obviously a different part of life. And most people eventually go down that path. So, take advantage of the times that you have to do those things. Yeah.
Congratulations.
Yeah, thanks.
You're welcome. And I absolutely agree. I went to Nicaragua last year and had very little planned out.
Awesome.
And it was definitely one of my favorite trips that I've done.
Oh yeah, for
So I
sure.
agree with that. So you decided to pursue the PhD in interdisciplinary aging, mostly because you saw that interdisciplinary aspect of it. But then you open up this podcast saying that you're a gerontologist and a meta-gerontologist.
Yeah.
What were some of those big leanings that you gained throughout this program, and how did you grow into like that aging studies part of the work?
When I saw Tulane come out with that program, it was just in time. I was in the middle of my master's program when they did it, and I ended up matriculating into the second class of that program. And it was just in time for me, because I knew that I wanted to do an international placement, and the person who helped us with that, pick a certain place, was I told them, hey, I'm now exploring aging. Can you place me somewhere that focuses on older adults? And so they did. And like I said, it was an interdisciplinary part that caught me. And so I had that experience in India where I interned with an organization that serves older adults. I started reading more books on aging. And then I was thinking to myself, and I got more interested in it. And I was thinking to myself, if aging is something that encourages interdisciplinary thinking, and I really like interdisciplinary thinking, then this is probably something that I should go toward and pursue. And I've just become more and more interested in it, obviously. And aging is universal, right? Time moves only forward for us. As soon as you're born, you start getting older, and that happens for everyone. The only kind of experience with life that is more universal than aging is death, and aging is the step before that. So, I think that despite the fact that it's something that everyone can relate to, of all the different kinds of isms that you can think of and phobias, homophobia, racism, sexism, ableism, etc., I think the data would back me up on this, that ageism is the one that gets a lot less attention. And I'm not, all those issues deserve a lot of attention, but as a gerontologist, I'm definitely going to focus on ageism. And, I think we have a long way to go. Demographically, tons of people are getting old, but we are not a society that is very good at facing that reality. We need to be a lot better. So, the more I learned about it, the more interesting it became. And now it's me. That's what I am.
Yeah, I appreciate that. And I'm going to butcher the stat, but I definitely saw a stat recently that by 2034, most adults, I think the majority of people in the US are going to be above 65 or
Yep.
some sort of derivation of that stat. Just saying that a lot of our population is going to be aged, like a high population, a high amount of the population is going to be of that older
Yep.
age group. So how are we thinking about solutions for those groups?
I know, and there's no social, political, economic, cultural, or epidemiological or demographic reality that is separate from or independent of that fact. Everything is tied to that, and it's going to be a foundation of what our country is going to look like moving forward. That and I don't remember the year, the 2040s maybe, where whites will not be the largest majority. So, population aging, immigration, and these different demographic and epidemiological transition. It's easy to connect they're all connected to one another. A joke that I did with my students was, I don't know if you've ever heard of the game 6 Degrees of Kevin Bacon. You connect any movie within 6 degrees to Kevin Bacon because he's been in a lot of movies. So I would joke with my students, let's do the 6 degrees of aging. Give me any issue at all, and I can connect that within 6 degrees to how this is related to aging. So that's where we are right now. I could go on for hours talking to you. You could throw any social issue out at me right now, and it's so easy to think about how that's tied to aging, right? So yeah, that's our reality, and we're headed where you just said, but somewhere in I think it is sometime in the 30s where the majority will be over 65, but we are not equipped to handle that right now.
What is it that people get wrong about gerontology or aging populations?
Well, I'll focus here on the U.S. in particular. We have by far the highest healthcare expenditure than any other country in the world. It's not even remotely close. But we have some of the worst health outcomes among industrialized countries. First of all, we should be absolutely embarrassed about that fact. That's embarrassing. Our healthcare is incredibly inefficient. We do not get the best bang for our healthcare buck. A large percentage of those healthcare dollars are spent in older age, especially in the last 2, 5, 10 years of life. We just spend way too much money. It just doesn't have to be this way. And it's not, lifespan's not the only important thing here. Health span is important. So many people have told me when they find out that I'm a gerontologist, like, oh, you're trying to figure out how to get us to live longer. And I'm like, wait, you don't want to just live longer. You don't want to live until you're 90, but 30 of those years you're sick and have disability. Our health span also matters, and we're lagging behind when it comes to that. We're lagging way behind. Remind me what your question was.
What do people get wrong about aging?
Yeah. I think that there are a lot of things about this country that has not set us up well before we ever anticipated of having this kind of population aging. That has not set us up well for success in that regard, and that's true at kind of the national policy level. At the individual level, like I already mentioned earlier, we're just not good at planning ahead. People don't want to talk about their own mortality. As counterintuitive as it may sound, I actually think that the more we brace our own mortality, the higher our quantity and quality of life will be. But we just don't want to talk about that. We don't want to get life insurance. We don't want to go ahead and put some money aside to plan for our funeral and whatnot, so our children don't have to worry about that. We need to get better at having those conversations. I think that we are, but we'll have to see how your and my generation does better when we are in older age, right? Maybe things are getting better, but those are some things that we just don't do well. And aging is extremely gendered as well. It's very, very gendered. That's a whole other conversation. But anyway, we got to get better.
Appreciate you sharing that. You were also a guest professor at China University of Political Science and Law. Tell us about that experience.
It was when I was in the PhD program. One of the members of my dissertation committee was a Chinese woman, and she was in the School of Social Work, and she just approached me one day and was like, "Hey, Jacob, would you be interested in going for the summer to teach a couple of guest courses in Beijing?" I'm like, hell yeah. I had already been to Beijing previously once, but this is a good opportunity. It's a good thing I did it. It's the only teaching experience that I had before I landed my first job as a professor right after the PhD program. So it's a good thing that I did that. And it's China is an interesting country for just about every reason. It differs. Let me think of how to say this. The ways that the U.S. and China are different are just as remarkable as the ways that we are similar. Mm-hmm. Teaching, being in a university setting in a country where Marxism is the foundation rather than Western thought, like it is for us, it's very different. And I had a lot of interesting conversations. Social work there, it's more so that Chinese, if I understand this correctly, I guess there's less latitude for many Chinese people to choose their careers. And so a lot of people were sitting in the social work class and they didn't really love the idea of being social workers. I don't remember the full details. It's just really interesting. It's an interesting place to teach. I'm glad I had the opportunity. In every single place that I've been to, including there, in every single experience I've had abroad, I've learned at least as much as from them as they did from me. So that's definitely true in this case.
Well, it seems like it's definitely a rewarding experience in of just that. If it's just that you're gaining it, so that's awesome.
Yeah.
And then you graduated from your PhD program. You became a visiting assistant professor of social work at Taylor University. Tell us about that process coming out of the PhD.
Yeah. So that was only visiting assistant professor because it's a really small school and I don't have the clinical experience, and a really small school cannot afford to give someone tenure or put them on the tenure track if they can't teach across the entire curriculum. I can't teach the clinical courses in social work. That's why it's visiting. That's fine with me. I didn't want to live in Indiana. It's too damn cold up there. And all my family's back here in the South. So the job that I got after that was teaching global health. And that's turned out to be a good thing about having both the MSW and the MPH is that I can teach in either of those fields. My first one I got was social work though. And I prefer to teach public health, but I will say, Taylor University is a very evangelical conservative institution. Social work is a very progressive field that focuses on social justice. So I'm just going to say teaching social work in that kind of setting is both challenging and a hell of a lot of fun. Yeah, we in the social work department, we really shook things up because we have competencies that we have to fulfill, right? And there's a code of ethics. And if you're a social worker and your theology tells you that being gay is sinful, but you're a therapist and you have a gay person come into you as a client, you can't treat them any different, with our code of ethics and whatnot. So we had a little bit of latitude that I think other departments didn't have because of that accreditation standard. Unfortunately, I know that there are many social work programs at other conservative institutions that probably don't follow the code of ethics because they let their theology supersede that. But we had a really good department. It was a great experience. And especially since I was a visiting assistant professor, I did things that I might not have done if I were trying to get tenure, as far as teaching some things in the classroom. So that was a really positive. That was a really cool experience to have. That I'm glad I got to work in this setting that I otherwise would not belong in.
And why do you prefer teaching public health over social work?
Social work is heavily focused on clinical, mental health especially. I don't have that background and never wanted to get that background. I don't really like working with individuals. And so because it's so heavily favored in that direction, I think that macro social work, which is basically public health, the social work profession doesn't do nearly as well with macro social work that I think that it can, whereas public health does very well with it. And public health thinks much bigger picture as well. There is such thing as international social work. You do have some social workers focusing on global health and really having big picture stuff, but I just think that public health does a lot better at it than social work does. I love comparing epidemiological trends between different countries, right? That's one of my favorite things to do. That doesn't fit as well into a social work course. It fits perfectly well in a public health course.
That makes sense.
Good question, by the way.
Yeah, of course. And you're sharing that you were assistant professor of global health studies at Mercer University. So tell us more about that shift.
Yeah. So Mercer I was working in the College of Liberal Arts and Sciences, and that particular part of it was basically like a liberal arts college. But Mercer also has law school, med school. They have a school of public health. So that's separate. That's where you just go get a public health degree, your undergraduate degree. The way that I describe the global health studies program that I was in is that it's an undergraduate public health degree housed in a liberal arts context, which I think honestly is even better. As much as our society wants to degrade the value of a liberal arts education, I don't think that's a good thing. I think there's a lot of value to that. And all of our students were required to do something international, whether it's a 3-week trip or a whole summer or whatever. And so it was really great being able to, most of my students were either planning on traveling soon, or they had already been on a trip. And I've been to various places around the world, and that's just something that I can relate to my students with. Like, hey, I can share my experiences with you. You can share your experiences with me. And again, like, my focus was international health and development in my program, and so I got to design my own courses, and they were all approved, and it was awesome. And I thought I was going to retire there, quite frankly. I chose to leave, and we can talk about that if you want. But it was really nice being able to design my own courses. I taught a course on dying and death, a course on demography, a course on epidemiology, a course on vulnerable and oppressed populations, and I designed all of those, and I just had a lot of latitude with that. And that's another thing is with the strict accreditation requirements in social work, you have to have so many certain courses. But in a global health program, we created it. It was what we wanted it to be. And so, yeah, it was really cool. It was a great department, and the reasons I left had nothing to do with the department itself.
Yeah, and if you don't mind sharing, why were those reasons that you left?
it was the conflation, not conflation. A lot of situations merged around the same time. I had my second heart surgery, and that definitely impacted me. I mean, that was really one of the most difficult days of my life is when I learned that I needed that second surgery, and I had that surgery in the middle of my time working there. It was right before COVID hit. It's late 2019 when I had that, and then COVID hit, and I don't know. There was just something that hit me like, man, I thought that getting tenure gives you more freedom, but I observed my friends and peers getting tenure, and it seemed like it was actually the opposite. I thought it was absurd that we have the highest degree possible in our fields, yet faculty pay is not that good. That's just really, that sucks. The small business bug bit me, so I wanted to pursue those things. My dad had a debilitating stroke, and so I moved back. My wife and I moved back home to help my mom care for him. Yeah, it was several different things that happened all around the same time. And bigger picture, I don't really love the direction that academia is headed. Like healthcare, it needs a lot of reform, and I don't know that it's going to do it anytime soon.
I'm sorry that was a tough time in your life.
Such is life. But thank you.
Yeah, of course. So you were co-founder and executive director at Groundworks Resources, as well as co-founder and administrator at Endpoints LLC. Tell us about those positions.
Those are the very first businesses I started, and someone that I met in Macon, Georgia, where Mercer University is, where I was teaching at the time. He's also a social worker. We started talking about like, man, we would love to have this kind of agency. And we first started Endpoints, and then we started Groundwork. Endpoints is a small mental health practice. Groundwork provides grant writing and other services to nonprofits. He and I both started both of those. They're separate from one another. And I learned a lot. I've learned a lot about business. I've read that hardly anyone has their first business be successful. That's been the case with me. um, but I've largely stepped away from those. I don't spend much time at all on those anymore. But they were my first ones, and I've learned a lot from those. And we've done some good with them. But I've moved on to things that I think I'm better at. And like I said, ideally you get better and better at businesses the more that you do it. So yeah.
And what were your lessons around business that you learned?
You got to stick with it. It's so many people give up too early, but you're not going to get it right the first time. You're not going to get it right the second or third or fourth time. And you got to stick with it. You got to have a lot of resolve, a lot of patience. It's a lot like a dissertation, honestly, where you just kind of go down rabbit holes. You stumble across things and get lucky sometimes. It's also a really crowded market. So, it can be tough to really hone in what your specific thing that you're offering is. Again, you gotta kind of stick with it, and you got to be okay and know when to throw in the towel. Um, if you find that your current thing's not working, move on to something else. And if you find that you're not into the business thing, and you want to go back to be employed, then practice grace on yourself. There's nothing wrong with that. So practice a lot of grace with yourself. Be patient, stick with it, and embrace the fact that what you are as a business owner 5-10 years from now is not going to be the same as what you were when you started. It's going to change. That's okay. It's a good thing.
Absolutely. And this was when you started off your Masters of Divinity, Theology at Mercer University McAfee School of Theology.
Yeah.
So maybe talk us through that thought process. You said that you had a personal interest in it, but I feel like there might be a little bit more in that, because a lot of us have personal interest in lots of things. We might pursue like a master's degree. So love to hear more about that thought process.
Yeah. That's interesting that you have that perception. It's always been a thorn in my side, even though my religious beliefs and ideologies have shifted over the years. I do not have the same religious identity as I did when I was back in college. And it happened at the same time. My wife and I were having these conversations like, should I leave my tenure track position? And at the same time, because remember, I had a heart surgery. Like I wanted to do what I wanted to do, because even for a moment, when you have to face your own mortality, you just have a different view of things. And I was like, I've always wanted to do this. I'm going to leave this position to pursue businesses. Maybe this is also the right time to pursue the theology degree. And there was no way in hell that I was going to take any more loans out because I've already got too much. So the deal was I'm going to apply to several places and I have to have full tuition scholarship or better, or I'm not doing it. And I ended up getting that offer at several different places. So then we had to choose which one we were going to do. And I chose a different one originally. It was going to be in person, but then my dad had a stroke and we were going to move to North Carolina, but then he had a stroke. So my wife and I were like, we're just going to have to pass on this. And fortunately, McAfee, the one that I'm at, has a fully online program, and they scrambled together to get me a full tuition scholarship almost last minute. And I'm doing it only because it's online. It's in Atlanta. I'm not living in Atlanta. So it's been an interesting road. It is... I would not be able to fit in well at most seminaries because of my own beliefs and views and whatnot. But this is a good fit. It's an okay place to be, considering where I am with my own worldview and whatnot. It's the kind of thing where I could get a degree in anything, and I think that it's going to enrich whatever I'm doing professionally. But as of right now and what I'm anticipating, I don't need this degree to do what I'm going to do professionally. So I probably consider it mostly personal. There are all kinds of things. If I were going to live to 150, then I would go get a law degree and probably one or two other things. So I just love being in the classroom, whether I'm at a desk or up front teaching. So yeah.
Yeah, well, I appreciate that, and I look forward to you completing this program. And
me too.
And this, despite it despite it's something that you're doing because of personal reasons, I'd imagine that you're still learning perspectives or maybe takeaways that you are maybe pulling into more of your public health thought processes or healthcare processes. So maybe what are some of those like through lines that are maybe helping you in shaping some of your perspective now?
Yeah, I mean, what I do now is the thing that I spend the most time on is my business, The Smart Patient, and that's what I said at the beginning. It's healthcare advocacy, helping patients and caregivers navigate healthcare, and that's my business, Smart Patient, smartpatient.com, and I mainly do speaking. And as of now, most of my speaking gigs have been at churches. I don't know if I want that to be the case moving forward, partly because churches don't pay as well. But I definitely think that there are settings that need to hear these things, because pastors, and they'll tell you this, they don't always know how to deal with, they're going to sitting in hospital rooms at the bedside of their patients or visiting their homes or whatnot. But, they're focused more on the spiritual, theological questions, not the, hey, I don't know what to tell you here about this, what to do as a patient or as a caregiver, right? And also because many younger people are distancing themselves from the church, that means that many churches are skewing toward older populations. So that's, gerontology comes in there. And as I said earlier, most people die in older age, which means that naturally as a gerontologist, I'm also focused on end of life stuff. And we have a lot of spiritual questions come up. Regardless of what your religion is, you have these questions at the end of life. And like I said, I want to be able to relate to people, use the right kind of language, and whatnot. Even if I don't share their beliefs, it doesn't mean that I can't meet them where they are. So those are some of the things that come to mind when I imagine how this can work as a part of my professional life. On the one hand, I really don't see myself being a minister, but on the other hand, there's been at least one major surprise every step of the way. So I'm sure there's more to come. I don't know.
Well, we'll be looking out to see what that major step just might be. But you mentioned it. So you're a speaker consultant and founder at The Smart Patient. What was the thought process in creating this business?
It was my own personal experiences, mostly as a patient and some as a caregiver. It's just so asinine that it's as complicated and inaccessible as it is. It just doesn't have to be that way. And I hit a breaking point. I don't know if it was a single moment. It was just kind of over a few years, it started becoming more and more obvious. Like, hey, it really doesn't have to be this way. Is there something that I can do to try to help with this? And I'm not, as of right now, I'm not planning on hitting at the highest levels, because that might be an intractable problem. If we really wanted to take down healthcare and burn it to the ground and reform it like it needs to be done, and we would have to convince a bunch of billionaires to stop loving money. That's not going to happen. So my particular place right now is focusing on individuals and families and communities at what can we do at the local grassroots level just to squeeze a little bit more juice out of your care, right? Because like I've mentioned, it's really easy to be a patient or a caregiver in our healthcare system and feel powerless. So if I can just provide some people with a few strategies and tips to help them gain, even if it's just a little bit of that power back, I firmly believe that can make a big difference in their lives over time. So that's what I'm focusing on right now. That's where I think I can have some impact, and I think I have a grander vision for how that impact can grow in the future. But this is where I am right now.
And what is one strategy that you help people in getting back power or building their own power in healthcare?
I think assertiveness is really big. In social work, we call it the passive, assertive, aggressive scale. And you don't want to be passive or aggressive most of the time. You want to be assertive. So, not confrontational, but don't be a doormat. And I think it's so easy. I mean, I've had conversations with people, and like my mom, for example, she and I both have a lot of medical appointments, and I'll tell her, oh, I had this conversation with my doctor, and I'll tell her about it. And she's like, you said that to your doctor? I'm like, you're damn right I did. Like, if you have a question, ask it. If you're not satisfied with the care that you're receiving, then let that be known, right? Don't think that, oh, the doctor said this, so I got to do it. Let's take a step. Let's take a step off to the side and really, do you have to? Because again, doctors don't know everything. So I really try to help people realize, hey, you there's some space here for you to push back a little bit. Do it do it politely. Don't be rude about it, but be more assertive. Don't just assume that what you're given is the only choice that you have. So a lot of it is helping with that assertiveness.
And you also do work around demystifying healthcare. How do you do this, and why is it important?
Yeah, that's the same thing. Basically, is trying to help people untangle what looks like a knotted mess to us. And sometimes I'll use the metaphor of it's all scattered, and I help connect the dots. And it really comes down to the same thing. What are some things that you can do as a patient that will make you at least a little bit more empowered, right? I have different specialists. I got a cardiologist and a neurologist and a pain doctor and a physical therapist and a dentist and all these different things. And they don't stay connected with one another as well as they should, as well as our system should. But they have more conversations with one another than they would otherwise because I've been assertive with it, right? And so, I help my patients zoom out just a little bit. They don't have to think about national healthcare. People who are in crisis aren't concerned about healthcare policy in that moment. But if you zoom out a little bit and realize, hey, this is a bigger picture, that can help a lot, right? If you're an older adult, then take your spouse with you, take your caregiver with you, take an adult child with you to your appointment, so you're not having to deal with this on your own. These little things like that. So that's a few examples of things that I talk about. Hopefully that answers your question.
Yeah, absolutely does. And you also founder, coach, and speaker at the Versatile Social Worker. So tell us a little bit more about that.
That's before the Smart Patient. I never wanted that to be my full-time thing. It ended up becoming my full-time thing because it's a huge need. What we're seeing right now with social workers, most of whom are therapists, case managers, and counselors, they've grown pissed off with the status quo, which means that they're way stressed out, they're burnt out, they're asked to do too many things, they're devalued at work, and probably most importantly of all, their pay is shit. And so they're getting really fed up. And I found that this was an issue, and I have a social work degree. So, I'm like, okay, well, this can be a side hustle thing because it's a really big need. And it ended up taking way more of my time. And after a while, I'm like, I don't want this to be my full-time thing. So the main thing it is right now, I used to be a coach. The main thing it is right now is an online course. And the versatile social worker is still active, but I spend much less time on it. It's more automated now because healthcare is my big concern. So yeah, if there are any social workers listening and you're interested in pivoting, that's what I help with is if they want to pivot to a new industry, I help them clean up their resume, cover letter, do good interviews and things like that. So that is still active, but it's mainly an online course.
And then tell me about that thought process of okay, you're starting this up as a side hustle, but then realizing that this isn't the thing that you want to devote your energy to and shifting that, like, because I think many times some of us don't know when to say,
Ah,
this is enough, or this isn't the thing that I wanted it, or this is more than I wanted it to be, or it's transformed into something that I don't like and stepping away. So what was that thought process for you?
well, even though I knew going into it, I knew that it was not what I wanted to do long term. It still ended up becoming more than I ever wanted it to, because you realize, like, oh, this is a big need. Let me go ahead and set this thing up so I can tap into this market. Oh, I need to do this extra thing. Oh, I need to do this extra thing. You got to put all these pieces together, and it becomes a full time thing at that point. It's easy to hit that point. And I knew going into it that I didn't want this to be my full time thing because, one, my interest is healthcare. Two, because I don't like individual coaching. And that's a lot of what I was doing in those early days with the versatile social workers, working one on one with them. But remember, when I said earlier, when I went into social work, I knew that I did not want to be a clinician. I don't like working one on one with people, right? That's not where my skills shine. And so, there had to be a point. Is like, listen, I'm not going to be happy 5 years from now if I'm doing the same thing. I'm not going to be. My wife talked about this, and I was stubborn for a while, but eventually I just had to, like, I'm stepping back. I've got this online course. That's what it's going to be. That's still out there. I still have a large network of social workers on social media. I still had people reaching out to me. I had a call just a little bit ago about someone interested in my services, but I just spend a lot less time on it. I'm a lot happier.
No, I'm glad that you're able to make that choice for yourself, because I think too often we get beholden to things that we used to like or aren't reevaluating and saying this isn't the thing for me right now and then dropping it. So that's awesome that you're able to do that.
It took me too long, but yes.
Fair. So before we move on to the Furious Five, where can people connect with you, and where would you like to see yourself in the future?
Connect with me at thesmartpatient.com. And I'm very active on LinkedIn, Jacob Evans Kendall. I have both the versatile social worker and smart patient have pages on there, so you can search for those, and then connect with me. Let's build your network, and I'll build mine, and let's have a conversation. So thesmartpatient.com, and hit me up on LinkedIn as well. In 5 years, did you say 5 years?
Future.
Oh, okay. Yeah, I mean, I want to become more and more recognized as a thought leader in healthcare. I believe that I have some good, valuable things to say. It's not going to happen tomorrow. It takes a while to build that kind of reputation and know-how and whatnot. I hope that I can achieve at least some fraction of the grander vision that I have, but I'm going to have to keep doing what I'm doing for now, putting my name out there, slowly having people realize that I have something valuable to offer. So yeah, I just hope it keeps growing.
Yeah, absolutely. I'm glad that I'm part of that journey, and I look forward to seeing where you do end up.
Yeah, thanks.
Of course. So moving on to the Furious Five, the 5 questions that I ask all guests.
Okay.
Number 1, what advice would you give to a student trying to pursue a career in public health?
Well, I guess you're talking about someone who already knows that they want to pursue public health. I might take one step back farther from that, but it's still going to apply. I had a lot of students who I taught the Intro to Global Health course, which was a part of the core curriculum for everyone. So I had a lot of non-global health majors in there, and I had a lot of people come up to me afterward and say, I knew that I was interested in health, and I thought that I had to go into nursing school or physical therapy or medicine in order to have a career in health. That's not true. Thank you for helping me to realize that. So I would say to anyone who has even the slightest hint of a notion that they might be interested in health or public health, realize that there's a lot of opportunity there. And there's so many ways that you can contribute to a better health without being a clinician. And even within public health is growing tremendously, right? The world now sees that public health is needed because of the pandemic. The pandemic is not an individual level issue, it's a public health issue. Epidemiological concepts are being applied to more and more questions, right? It used to be the epidemiology just studied infectious diseases. Now epidemiologists are studying marriage and divorce and all kinds of religious beliefs and all kinds of things. So public health is expanding. I think it's going to be one of the most important disciplines moving forward. If you have any kind of inclination for math, and do epidemiology, because epidemiologists are paid well. Okay, next question.
Number 2, If you're talking to someone wanting to get into your position, what advice would you give them?
Um, if you wanna own your own business, I'm guessing that's what you mean. Then, and you're in a place where you can still take classes, maybe take a few business classes. I never took a business class, and I've had to really learn some things on my own, and I have not learned everything that I need to learn. So if you're in a place where you have an opportunity to gain some skills that are really useful for business, like you're still an undergraduate student, try to do that. And also realize that you're probably not going to be successful next year. Of course, you have these people who get on YouTube and they get a 100,000 or a million followers, and they're millionaires or whatever. That's a very small fraction. Be okay with it taking a little while. Be okay with taking detours, and keep that central focus there.
Number 3, what's something you're working on improving in your life right now?
Oh, well, a lot of things. I'm just trying to pick the one to say. I'm in a really different place in life right now. When it used to be that whenever I was in one country, I was already planning what trip I was going to take next. And I haven't traveled in several years. It'll probably be several years before I start traveling again, because I'm married. I have a second child on the way. I'm in a different part of life, and I'm okay. I'm good with that. Of course, I still have those moments where I'm talking to someone else and they say, "Oh, I'm over in Australia," or "I'm down in Argentina." I'm like, man, I'm jealous, But you're going to go through different phases of life, and if you go through like I am now, where I'm kind of taking a break from this certain kind of thing that I love, it doesn't mean that I can't do it again in the future, right? So, let me look back at the question. Oh yeah, what's something I'm working to improve? It's just to remember that I can't do everything at once, and what I'm focusing on right now, there's absolutely nothing wrong with that, and life changes along the way, and you just kind of go with it.
Number 4, professionally, do you recommend anything?
Yeah, I see this list here: a book, podcast, YouTube, etc. My favorite way to learn is to read. I love reading, but not everyone does. And I can't just sit here and say, go read these 10 books. They've been really impactful on me, because there are a lot of people who are like, I'm not going to go read that. And so they're never going to get those ideas. Know how it is that you like learning. My wife likes podcasts a lot more than I do. She watches a bunch of documentaries. I'm a huge nerd, but I just don't like documentaries. But there are so many different ways that we can learn now. Find your way and embrace that. I don't know anyone who learns from all the different ways, and there's nothing wrong with learning from this way or that way. We live in a world now where we don't just have to have books. We don't just have to have classrooms either. I think the value of a college education is going down. So embrace that there are many ways you can learn, and that's what I would say. Find your way, and there are thousands of podcasts. If you're a podcast listener, you got a lot of options for you. All right.
And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
It's hard to, anything that I could sit here and say, it's like, well, I ended up really well anyway. If I'd in the romantic area, I was just really terrible at it for many years, but then I ended up with who I am now, so did a whole bunch of mistakes lead me to this. It's the same thing with my career. There was a time there, and I almost took the path of going all in on biology, going to get a PhD in biology, being a biologist. And I can sit here and I can say that I regret that. But if I went that path, I wouldn't be doing what I'm doing right now. And I think what I'm doing right now is what I should be doing. So, yeah, those are the kinds of things that I would say that I have regrets for. Is it ended up being pretty damn good anyway. So, yeah. maybe I would choose. I chose a. I don't go into the details. The option that I chose for my first heart surgery made it such that the issue that I ended up having, and it needed to be replaced again, there was a high risk for that, and I knew it. If I had known that, would I have chosen another option that would have made a second surgery much less likely? Maybe so. But there's no way I could have known that at the time,
Yeah. Understood. Well, Jacob, thank you so much for coming on and sharing your story and insights. It was a pleasure chatting with you.
Yeah, thanks for asking great questions, Omar. I appreciate that. I enjoyed it.
I definitely try to do that. Housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe if you have not as yet. Leave a like, a review, and share this with a friend. Greatly, greatly appreciate you all, and see you all next week. Peace, everyone.